Respiratory System Diseases, Common Infections by Bianca de Silva Carmo. What is the respiratory system and what does it do? The role of the respiratory system is in charge of eliminating carbon dioxide, which is a waste product of metabolism, and supplying oxygen to the body. The components of the respiratory system include the air pathways, muscles, blood vessels, and the pleura. This starts with air entering through the mouth or nose, where it is warmed, moisturized, and filtered. The air goes through the larynx, which houses the vocal cords, after passing the syrinx. The air is directed into the bronchi, which are wide airways that enter each lung by the trachea. The bronchi and the lungs divided into bronchioles, which are smaller passageways that terminate in alveoli, which are tiny air sacs. The gas exchange takes place in the alveoli, where carbon dioxide is released and oxygen is entered into the bloodstream. And during breathing, the diaphragm beneath the lungs aids in regulating the lungs' expansion and contraction. And the function of the respiratory system is exchanging carbon dioxide with oxygen, breathing and inhaling, and exhaling as well, providing oxygen to organs and the tissues, and eliminating carbon dioxide. What causes common infections in the respiratory system? The causes are due to bacteria, fungus, and viruses. The most common infections are viruses. For example, the coronavirus that led to COVID-19, the rhinovirus that caused the common cold, and influenza virus that caused the seasonal flu. The more serious illness that, like for example, bronchitis and pneumonia, can be caught by bacterial infections instead of viruses. Histoplasma and other fungi can also cause diseases like histoplasmosis, and allergens and irritants such as dirt, mold, and pollen, and smoke and pollution can aggravate respiratory disorders like asthma and increase the risk of infection. And how does common infection spread? Poor hygiene, which compromises immune systems. Crowded living situations can increase contracting illnesses, for example, through coughing, sneezing, or being in close contact with an infected individual, or dirty surfaces. Otitis media. What is otitis media? What causes it, and what is affected by it? Children frequently suffer from otitis media. It is an infection or inflammation in the middle of the ear. It usually results from the upper respiratory tract infection and is brought on by bacterial or viral infections in the middle of the ear through the eustachian tube. The typical causative agents are Haemophilus influenzae, the influenza virus, rhinovirus, and so on. Particularly in cases with the eustachian tube being compromised, it allows for the infections to colonize in the nasopharynx and spread into the middle of the ear. Otitis media typically begins with germs from the upper respiratory infection, which could be through your nose, your mouth, or your ears, such as a cold passes through the eustachian tube from the nose or neck into the middle of the ear. This tube is trapping this fluid in the middle of the ear, which is obstructed due to mucus. The infection continues to go through the warm, humid environment, allowing for the growth of bacteria or viruses. And certain bacteria have unique mechanisms that allow them to spread the illness, like virulence factors. And otitis media is a condition affecting the middle of the ear. Symptoms, for example, like ear pain, fever, irritability, and a potential temporary hearing loss due to the fluid that build up in the ear. It usually begins after the upper respiratory infection happens. There's inflammation and dysfunction in the eustachian tube. Chronic symptoms of the otitis media can be very hard for young children, which might require surgical intervention. However, with the diagnosis and antibiotics, it can be fully cured and have no little to no complications. Transmission, it is not directly contagious, but the virus and the bacteria can lead to it being contagious, like how you pick it up. These germs can be spread through like coughing. It can be through sneezing or sharing the same surface with someone else who is infected. Catching a cold or having the upper respiratory infection can lead to the inflammation and buildup of the mucus, which can lead it to become infected. Treatment depends on the severity of the otitis media. The doctors recommend to have a watchful eye for it to see if it gets worse or better. If it gets more severe, antibiotics can be prescribed, or pain relievers such as acetaminophen or ibuprofen can be used. If not, it should be cleared within a few days, or depending on the severity, a couple of weeks. To help prevent it, do hand washing to avoid getting contaminants, reduce smoking, and vaccines can also help prevent ear infections. For example, the PCV 13, and as well as the Haemophilus influenza type B Hib vaccine. And the Streptococcal pharyngitis, I'm not sure if I'm saying that correct, but in other words, strep throat. What is strep throat, what causes it, and what is affected by it? It is a bacterial infection that causes inflammation in the throat. It is caused by the bacterium called GAS or gas. It's right here. It is a gram-positive, round-shaped bacterium that forms chains and produces like a range of infections that can be from mild to very severe symptoms. Strep throat can begin with when the bacteria enters through the body, usually through the mouth or the nose, and attaches to the lining of the throat. It produces M proteins, where it allows itself to stick to the throat and attack the immune system. This allows it to multiply and release toxins, damaging the tissues of the throat. And this cause is now pain and swelling and redness, which is the strep throat infection, which tends to lead to swollen glands, redness in the back, pain when swallowing, and whiteness in the back. All right. Yeah. All right. Strep throat is easily spread through through infected people through the droplets, through, for example, coughs, sneezes, or talking. It can spread through like touching surfaces or objects with the bacteria on them, or touching your mouth and nose. The most common treatment for strep throat is antibiotics, usually penicillin or amoxicillin. It reduces the length and the severity of the illness, and reduces any complications further on. Pain relievers can also be used, for example, ibuprofen or acetaminophen, to relieve that throat pain or potential fever. And prevention, there's no current vaccine available for strep throat, but researchers are working on stopping the spread of this bacteria by frequently washing your hands, avoiding contact with an infected individual who is coughing, sneezing, or touching their mouth, and not sharing utensils, drinks, or toothbrushes that allow the bacteria to spread. I did forget this part, but the disease that is affected, the organs are the throat and the tonsils. The signs of the symptoms are sore throat, redness, swelling, white patches, and pain in the swallowing. The incubation period can be 2 to 5 days after getting the infection. The acute stage is just a week. with the symptoms continuing to grow. And resolution complication, if you take your antibiotics, you'll have a full recovery with little to no treatment. You can have very severe complications such as kidney inflammation, rheumatic fever, and etc. And people who are living with these conditions is very uncomfortable in the throat. It's horrible throat pain, and yeah, especially talking with strep throat. I have horrible allergies myself, so I experience both these things a lot. So it is not so fun. I need a lot of lozenges. And here are my resources that I used for the presentation, and thank you so much.